So we got a really good survey of the entire kind of healthcare landscape there. And that was really helpful for me because as I was pre-med and knew healthcare was something I wanted to go into, but I kind of wanted to increase my context for, future practicing and just kind of understanding what I was getting into. So this is a really, really good program fit for me. We got to see clinical aspects, real field aspects of kind of how public health is practiced in the real world. We learned a lot from different healthcare professionals, and that was very informative. It was a really good, like 360 kind of both high level and down low on the ground view of what public health and just healthcare in general is like, especially in a different country. So that was kind of good to parallel things we see in the United States with what goes on in Chile. The excursions were like the unexpected benefit. I didn't really know what to expect from those. I thought it was just going to be like field trips. And I think that is probably where some of the best learning came in. We got to really immerse ourselves in the different places we visited and also got to do some great sightseeing, which was really neat. The first one that we went on was a brief excursion into Peru, which is very close to Arica, which is something kind of cool to know. And we did a public health awareness little campaign with some HIV/AIDS testing and a pregnancy awareness and nutrition class with some women in the healthcare clinic there. And that was really neat to be able to participate in an actual program that's offered by some primary care clinics. My favorite excursion, I think, was the 2-week trip to the southern part of Chile, which is completely different from Arica. Arica is pretty dry, and the southern part of Chile is very lush and green, so it was a nice change of pace. But that's where we really focused on the indigenous healthcare of that region because the Mapuche people are a very active and prominent indigenous group still, and they kind of provide their own healthcare, and so we got to see what that was like alongside the healthcare that Chile's government mandates. And we spent some time with Mapuche in Chile and also in Argentina, which is beautiful and again completely different from anything we'd ever seen before. And so the sightseeing alongside the learning from medicine men and the Mapuche culture was very, very interesting, and again showed the importance of healthcare and how people really kind of that's like the main central part of lives across the world, that your health is very, very important and it's your well-being, and there are all different ways to treat that. And our final excursion was to the Altiplano, which is in northern Chile, not far from Arica, but it's where you go up to like 13,000 feet into the Andes Mountains, and we got to experience another indigenous culture there that was completely different from anything we'd seen before, near Bolivia and in kind of the more rural areas. And so that was very interesting because they also have developed their own kind of cultural healthcare knowledge, and that was really cool to see that something could exist so fully developed but also so remote from other societies and cultures. So I really enjoyed those excursions because they got us kind of out of our comfort zone in Arica and out of the classroom, but we were still doing a lot of learning and a lot of hands-on experimenting with healthcare in other places. Learned a lot from living with the family because that's kind of the best way to get a first-hand interaction with how culture works. And so they were really great about kind of introducing me to different aspects of Chilean culture. They hosted a huge party for the Independence Week celebrations, which was a lot of fun. And they kind of, the host family really gives you the insight into what daily life is like in Chile. And from my experience, I think that's the best way to learn the language, because if they're willing to speak only Spanish with you, you have to learn to adapt, and you're kind of with them all the time, and you're not kind of with your friends, you kind of can fall back on English, but with a host family, you really can't, and you have to be able to, be patient with yourself, but also be patient with them as they're trying to understand you. I mean, I thought that's where my Spanish really grew the most, was living with them and kind of learning how they did things and how they spoke, because that's the best way to learn conversational Chilean Spanish, I think. That was really wonderful, and kind of the host families are really great about bringing you into their fold and treating you like a child, like their own child. And I think that's important to how someone's experience abroad can play out. My ISP was in So all the ISPs are in public health, obviously, but my ISP focused on people with disabilities in Chile because my youngest brother in the United States has Down syndrome, and so I've kind of always grown up around that and been very interested in the rights of people with disabilities and kind of what they do for healthcare. And Chile has one of the highest rates of people being born with Down syndrome in the world, which is they suppose is due to some other cultural habits. But so my research focused on looking for what the available resources and rights and kind of the healthcare situation of people with cognitive disabilities in Chile. And I focused on adults, so those over the age of 18, because they kind of, once you turn 18, are essentially a ward of the government. You can still live with your family, but there aren't any compulsory education requirements or anything like that. So I kind of looked at what they were able to do, if there was financial help or university help or school help, and really found that there are a lot of things available. There's not a lot of unity, and kind of it's hard to find what's available for families. So once they kind of find one thing that's useful for them, they stick with that, whether that be the university or some public health, because there is a disability branch of the government that focuses on giving them money and healthcare. But there's kind of not a lot of communication. So if you need therapy, it's kind of hard to find that. Or if you've been involved in one program and are looking for something else, there's not a lot of communication between those. And so my research was really focused on like talking to families, talking to the therapy centers, or there was a university that did an entire degree program for people with cognitive disabilities that gave them a certificate that they could use to take into job training or something else. So I talked to those people and kind of learned about how they did their research and forming those programs, and how they worked in the communities. So it wasn't as much like hands-on delivering public health programs or delivering healthcare to anyone, but kind of seeing what was available in just a high-level survey of the healthcare and essentially the cultural landscape of people with disabilities there. And I really enjoyed that. I think the ISP is a great culmination of everything you learn through the SIT classes, and just the whole program kind of gives you this big picture, and then doing the ISP research paper helps you synthesize that into something meaningful and kind of getting a deeper look at what's going on there. So we learned a lot of the techniques that we needed to do to communicate with people, even if we didn't have a direct connection with them. So I thought that was very useful and kind of helped me do my research again, and I had to get on the ground and do some of the reaching out myself, but I knew that the SIT classes had really prepared me for that. So I'm starting medical school in 1 week from today. Going into medicine was something I've known I wanted to do since the beginning of college, essentially. And the SIT program that I chose really kind of solidified that life plan for me. I was pretty certain before I went, but after I went, after I went abroad, my decision to go into healthcare was 100% more solid. I think learning and seeing that healthcare is important across the globe was really valuable for me, and kind of getting to do it firsthand was really helped me decide that's what I wanted to continue to do. And my experience abroad was very valuable in medical school interviews. Every single interview I went to, they asked about my program, about my research, what I learned, if I could still speak Spanish. And so that was kind of a hidden, I didn't really think all of that was going to come out of my abroad experience, but I think it definitely had a big hand in how my futures played out. And so I will be starting medical school. I still don't know what kind of doctor I want to be, but this has absolutely had a big role in how I think that's played out. I think it's a really special study abroad program, because most of my friends were doing direct enrollment, and this is kind of a different layout and a different experience. And I really felt that I got a good cultural understanding of Chile, and kind of got like a broad understanding of what was going on in the country from a healthcare perspective. And I thought it was really unique that SIT did so much to prepare us within the classroom, with the excursions kind of out in the culture, and also giving us the independence to do our own research project. You really can't go wrong with any of those aspects, and I think they all have something to offer for somebody who's interested in doing projects.